look in the PPEs, do we need to use at this crisis moments a middleman or middlewoman, as you will call it? I think it's not. State facilities, and we are talking to our councillors in the regions, must directly go for direct procurement of the oxygen supply and so on, because most of the times is that these tenderpreneurs mainly look at profit margins that they are going to make, and then they might supply low-level oxygen products, or the quality might not be at the World Health Organization's required standards and so on. So it would be better to source some of these products or to procure them directly from the source itself rather than to use middlemen.
Henny Seibeb, deputy leader of the LPM, stated that the time has come to invest national funds into health, agriculture and education for the foreseeable future. Seibeb emphasized that during the COVID-19 crisis, investments such as the new SWAPO headquarters could have been used as a hospital.
Look at the SWAPO head office. Very big. Phenomenal. But if COVID continues for the next 10 years, if the tide continues, we must think of turning that big office into a hospital and to sacrifice and say, all right, in future, we can reward you with your head office or something. But for now, let's sacrifice what we have. There is helipad there. Have you seen a helipad at Katutura Hospital or Central Hospital? Those are the things that we must begin to. So our African administrators always put their minds on wrong things. How to loot further, how to create tenders, but not the current Minister of Health, Dr. Kalumbi Shangula, was the permanent secretary of Ministry of Health for many years. There has been nurses going on strike and so on. But when the man thinks that he can't be convinced from point A to point B, or from B to A, that is what will happen. So the collapse of the public health sector is also partly to be blamed to Dr. Kalumbi Shangula, because he was one of the longest serving permanent secretaries.
President Hage Geingob, according to Seibeb, should lead by example during this crisis, and his trip to South Africa to get vaccinated may send the wrong message.
And it's so shameful that the whole president, even he I don't know why he was even proud to say he organized for himself a medicine with what South African President Cyril Ramaphosa. That is the most blunderous thing that he has. In fact, that alone in other countries will have resulted in him being recalled immediately. You don't want to make use of the vaccine, AstraZeneca and Sinopharm, that he has procured for us. But he says, no, my doctor advised me, I must take, I think that one is Johnson & Johnson. Then he goes and take that one. Proudly, because he said Ramaphosa did not get any blood clot or what. So therefore he must also take that. It's so shameful. And he even says it publicly. Now, in terms of the fake news and things that are rising, how does he think, will the people think? They will think, even if the president doesn't want to take AstraZeneca and Sinopharm, I will go to South Africa and maybe go and inject it with Johnson & Johnson and come back. That's what people will do. That was wrong, totally uncalled for. He has a big mouth that he just say anything, anytime. He must learn to control his big mouth. And then probably it's him and his wife now that got injected, and his doctor probably. And the rest of the Namibians.
The Landless People's Movement also emphasized that the government should work to improve the state hospitals in order to provide better services to the Namibians.